Hello friends, I am Prabjot, your occupational therapist, and today I'm going to continue with my reflex integration therapy series, talking more about oral movements or oral reflexes. Commonly you talk about rooting or sucking reflex or even gag reflex, bite reflex, but there is another reflex we are going to address today, which is Babkin reflex. This is a reflex that specifically aids the child in breastfeeding in the initial stages. That is why this reflex integrates by about 5 months of age. It is a relatively lower level reflex, so a brainstem level reflex in the brain, and it helps the child to initiate feeding in the initial few months. Surprisingly, like rooting and sucking, which require the stimulation of the mouth on one side, this particular reflex even gets activated if you stimulate the thenar eminence, the base of the thumb of the child. Even that leads to turning the head towards that side, opening of the mouth to initiate the sucking action of breastfeeding. Interesting, isn't it? So it works on both hand as well as on the feeding and speech related skills of the child. So imagine if this reflex is not integrated, both the fine motor skills and the oral skills of the child in terms of speaking and feeding will be affected. In order to integrate this reflex, hand-mouth coordination is required. The first thing that the child starts reacting to is facial expressions. So if your child is older, get them into a habit of looking into a mirror and then trying to react to it, making different facial expressions so that their facial muscles get exercised. Self-feeding is something that the child learns in the form of mouthing. They try to put everything in their mouth as young as 8 to 9 months of children. So they try to bring the hands in the midline and try to put things in their mouth. That is the initiation of self-feeding. So, and later on you can provide them with food items and the child will try to put them in their mouth. This hand-mouth movement also helps in integrating the Babkin reflex. But also don't forget working on the fine motor skills of the child. So if your child has affected writing, Babkin reflex could be behind it. So any kind of fine motor activities that you practice with your child will help in integrating it. Also, playing of different musical instruments, either only with the hands or something that requires coordination with the mouth like a flute, could be beneficial. Second aspect of this reflex is use of suck, swallow, breathing pattern. In order to do that, try to introduce solids as soon as possible. Many kids are able to get introduced to solids by 10 months, but by 1 year, you should positively try to shift your child's diet to at least some form of active solids which they're supposed to bite, chew, and then swallow, so that a suck-swallow breathing pattern is developed. Also, if your child is older now, like 3 or 4 or 5 years of age, and you think the child has always resisted solid, try to introduce them in the solid food. Try to give them small bits or pieces of it in spoons so that the child's overall sensitivity also reduces. And 5 specific type of exercises that can help your child to integrate this Babkin reflex are any form of hand to mouth movement. So it could be simply taking a cloth and trying to wipe the face with it. Taking water and putting it in the mouth while rinsing when you're trying to brush your child's teeth. Or the child can use water to try to wipe any kind of extra food that is sticking around it. That is also hand to mouth movement. Try to guide the child's hand into eating on their own. So guiding a spoon towards the mouth of the child so that it's an active hand to mouth movement or at least active assisted. Second, stimulation of the palm is really beneficial. So you need to integrate this reflex from the thumb side. Place the ball in such a way so that the thumb is on one side and the palm is on other, and the child can do any kind of squeezing action with the squeezy ball, with a sponge. Anything can be used in this way. Water can be filled in the sponge and the child thinks it's a more fun activity. They try to squeeze the water out. Third, Any form of reaching activities that the child practices can also be beneficial, because the thumb is required for stabilization, and this part of the thumb, the base of the thumb, will be stimulated. So they try to reach out for different toys. So in this, you give a stable position to the child. For example, the child can be in a kneeling position. The child can be in a crawling position, in which they use one hand to reach out, and then they can try to reach out with the other hand. You can practice this with the child, and they can try to either throw the ball, or they can try to place it in some kind of stacking of rings or stacking of blocks that they enjoy. Fourth, reaching and pulling kind of games can be beneficial. So a tug of war kind of game can be beneficial with other children or with the parent, where the child tries to pull a piece of cloth or a rope towards them. Secondly, a pretend play game can be created, where you hang over some kind of shelf or a kind of a rod. You can hang a bucket on the other side, and the child is trying to pull it, like lifting water out of a well. So in this way, you can put blocks in it, so that the child pulls, takes the blocks out, and then you drop again, and then you put more. So it is like a pretend game for the child. And the final fifth exercise that the child can do is squeeze and release in a lying position. So the child is simply lying on their back. The child tries to squeeze their hands and then try to release them outward. With this, you have to ensure that the child is not turning their head at the time. The child is keeping their head stable. If it helps your child to calm down, they can keep their eyes closed if they are comfortable with it. But overall, this kind of action of squeeze and release is also going to benefit your child. I hope this video was informative for you. In order to understand how Babkin reflex can be helpful, if it is integrated on time, it can improve your child's fine motor skills, it can improve your child's speech as well as feeding. Please like the video, subscribe to the channel for more videos related to child development and reflex integration therapy. Add any queries or suggestions in the comments below, and do share the video so that maximum parents benefit from it. We will meet again soon. Bye.